Good to be live. Let's see. I just want to do this what do you call it now? Let's stand for my Facebook. Let's see. Just waiting for you people to pop on live. Hello, 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 hello. We're just going to have a clean. Hello, Chinimere. Is it Chi? Hello, Chinecherem Ogenye. Did I pronounce it correctly? How we are doing? It's a beautiful evening. Oh, I was right. That's good. I'm good with Igbo pronunciation then. How are you all doing? It's a beautiful evening here. I'm doing great, Chinecherem. I'm doing great. How are you all doing? Trust you all are having a beautiful and a wonderful time. I decided to come live today to say hi to everybody, and I miss my beautiful audience. I'm here to take your questions as usual and also have a beautiful conversation with you all. Kindly let me know where you are watching us from and also what is your name. What would you like us to call you on our live video? Okay. Yeah, Chinecherem. Yeah, Chinecherem. Oh, it's your first time here on our live. That's good. What brought you to our live today? Have you been following us on our YouTube videos? And what did you see that made you join our live? Like, let us know. I would like to know. Were you motivated by our YouTube videos to catch up with our live videos, or it just popped up on your notification and you decided to join and see how it goes? Joy Idiakwa. Oh my God, that name looks very familiar. I know Joy. I've heard about, I know Idiakwa's family. I know Joy, but I don't know if it's the Idiakwa is a very big family. They are very, very big family. I don't know if it's the Idiakwa I know, please. Good evening. It's my first time here. Thank you very much, Joy Idiakwa, for joining my live. I love you. Oh, Chinereme said, I love your teaching. Thank you very much. It's beautiful seeing you here on our live today. We have Chris. Chris says, good evening. How are you today? I am doing perfectly fine. How are you doing? Then we have Musa Dan Chabota. Good evening. Good evening, Musa. Musa Dan, how are you doing? I love your teaching. Thank you very much for liking my teaching. Oh my God. It said it's Idiakwa, from Ekboma. Oh, it's nice having you. I'm trying to remember. I've heard about Joy Idiakwa. I'm trying to remember the name. Like, I'm trying to see if I can picture the face and remember the face. Thank you very much, Joy Diakwa, for joining us on our live video. I really do appreciate it. It's beautiful. I'm seeing somebody that I know on my live video. Yes. A Diakwa family is like a very, very close family to me. I have a very, very good friend from that family. Even today, so we are still friends, and she's been a blessing to me. And I'm so happy seeing the relation, the one of the sister here. It's a pleasure to have you here. Idiakwa is, I think, my best friend from university days to this very, very moment is from Idiakwa family. Yeah. And it's beautiful seeing you here, Auntie Joy. Thank you very much. Let's see. I'm going to be reading where are you from? I'm from Nigeria. I'm from Edo State. Yeah, I'm from Edo State in particular. I'm from Nigeria. Chinechere said, I am watching from Anambra State. Thank you very much, Chinechere, for joining us on our live. So on Facebook, we have Sonia. Sonia Enge is joining us on Facebook on our live video. Thank you very much. Then we have Malik. Malik, hi, how are you doing? And we have Panda. Panda said, I am from India. Hello, Panda. How are you doing? We have Rem. We have Rem 1. Are you a doctor? No, Rem. I'm not a doctor. I am a registered nurse midwife, but I'm currently practicing as an anesthetics and recovery practitioner in the theater. So I work with doctors, I work with anesthetics to make sure the surgery goes well and the patient is fine post-operatively. So that is what I do. So I am not a nurse. I am not a doctor. Rather, I am a nurse and also a midwife. Okay. So you cannot picture the face. Ah, I think I can, but I don't know which particular dress. So bear with me. So we have LG. Good evening. I am Lesia from Zimbabwe. It's my first time. I really enjoy your teaching. Thank you very much, and I'm glad you enjoyed our teaching. Sonia, how are the kids doing? They're doing great. They're doing fine. They are with my husband, and I decided to have time to do my own thing. So Doreen said, it's beautiful seeing you here, Mama. I love your teaching, watching you from Kenya. Hello, Doreen. It's actually lovely seeing you on my live, and I really do appreciate. So we have Success Grace. Hi, Nurse Mercy Mary. Good to see you. Good to see you, Success Grace. It's a beautiful evening, and I'm happy and glad that you are on my live today. So we have Raju. Raju said, hello, mates. I am from India. How are you? Hello, Raju. How are you doing? I have a lot of Indian people in my community. And unfortunately, one of my videos was banned from Indian. Yes, I got a legal write-up from YouTube saying that one of my particular video cannot be played in Indian because of their rules, which I respect and which is fine. So it's nice to have my Indian community here on a live video today, and I don't take that for granted. So Chirgis asks, what topic do you have for us today? In terms of the topics I have for you today, it's going to be based on what you want me to talk about. Yeah, you have to tell me what you want me to talk about. And if you have any questions in regards to your health, it could be reproductive health, your sexual health, your general health and well-being, feel free to drop on the comment section, and I will be willing to take those questions today. Thank you very much, Adeboye Oluwashikemi Thomas, for watching. Thank you very much, Sarah Princess Okoye, for watching. So we have Ebere David from Nigeria. Yeah, I'm from Nigeria. Ebere David, are you from Nigeria? The names sound Edo-like, and your name is sounding Nigeria-like. I believe so. Ebere David is from Nigeria. So we have Ayere Emmanuel. Nice one. Thank you very much for joining. We have X Shiva. Hi, we have X Shiva. I am from India. Hello, X Shiva. How are you doing? So we have Ebere David said, where did you study in school? I am Igbo. Okay, I studied in Edo State. I am Edo State. I studied in Edo State, Nigeria, but I got married to a Delta Igbo man. So I am partially from Igbo, or I'm not fully Igbo per se. All right. So Raju said, drop your name. My name is Mercy Mary. My name is Nurse Mercy Mary. I like adding the nurse to my name because nursing made me who I am today. So my name is Nurse Mercy Mary. So we have Camera. Hey, I am from Pakistan. That's nice. It's nice having you from Pakistan over here, and I hope you've been enjoying our videos on YouTube. There's something about that's happening in YouTube now. YouTube is going to be transcribing our videos in different languages. We got an email from them saying that our videos are going to be in different languages in some countries. So maybe you'll be hearing my videos in German very soon. It's possible you'll be hearing my video in Latin very soon, or those languages very soon. I don't know, but YouTube they are working towards that, and that will be up soon. So whichever country you are, there's a possibility that my videos is going to be appearing in your own language soon. So Ebere David said, nice one. Thank you very much. So we have Rem1 says, are you ever in the UK? Rem1, I am currently in the United Kingdom. That is where I am working. All right, that's where I am working. So if you are watching this video, I would advise you click on the like button because it is very important. Okay, and also share with your colleagues. Let's keep interacting, and let's keep asking your question. Let's keep interacting. Chinechere said, please cause Staphylococcus infection. Staphylococcus infection is caused by Staphylococcus. It's a bacteria. Okay. I can't say what's today's lecture topic. Lecture topic, like I earlier said, it depends on what you have me to say, what you want me to say. It's going to be based on your questions. I'm here to take your questions today. If you don't have any questions, we can pick a particular topic for us to discuss, and I'll be glad if I get a particular topic from you. So Remwa says, I am in Newcastle. That's great, Remwa. Thank you for joining us from Newcastle. We really appreciate you. And to all the women out there, we just celebrated the Women's Day. Happy Women's Day to you all. You people are wonderful. We are wonderful. We are great. And I believe we'll be able to do more and we'll be able to explore a lot of opportunity out there. So, what is your mother tongue? If it's Raju, my mother tongue, I'm from Nigeria and I speak Edo. I speak Esan, Edo. Yeah, that is what I speak. That is my mother tongue. Okay. Let's keep it going. Let's keep it going. I need more questions, please. Ask me questions in regards to your health. So today, personally, I actually shot some videos which are usually based on life stories. Yes, I shot some videos based on life stories. Then today's videos are really regarding sex. They are really regarding sex and reproductive health. So the first video I shot today was about low libido, someone experiencing low libido from personal experience. So we're able to draft out that low libido. We're able to draft out the causes of the low libido and also how the individual was able to sort it out and the individual got better. Then also I did a video on how to talk about sex to your husband, to your wife. Like most times couples get married, but they are usually skeptical. They are usually shy to talk about sex. They talk about everything. They talk about vacation, they talk about the food they like, they talk about outfits, they talk about dresses, but they fail to talk about sex. And I wonder why. If you can talk about everything, why don't you talk about what is important? Why don't you talk about what is helping you bond? Why don't you talk about intimacy? Why don't you talk about it? So I was able to make a video on that, how to converse with your spouse when you are done with that. Then over time, I have been getting comments in regards to birth control and family planning. People keep asking, what birth control method should I use? What type of family planning method should I use? I heard family planning method helps to add weight, make someone add weight. I heard if I take family planning method, it's going to reduce my chances of getting pregnant. So there are a lot of misconceptions, a lot of myths about family planning and birth control. And I was able to make that video on that. I was able to make those videos on that. Those videos will be uploaded, but I really don't know the exact time they will be uploaded. But expect more interesting content on our YouTube channel. Currently, our video editor have not been able to edit some of the videos we've uploaded. We are supposed to upload a particular video today, but my video editor is unable to edit the video. That is why we are not having video on our YouTube channel today. For those that have been following, we've been uploading content in regards to fertility, in regards to childbirth, in regards to mother and baby at a particular moment. But from next 2 weeks or next week, the content might shift a lot to another particular topic. So if you have a pregnant woman or a nursing mother, I think these videos that we've uploaded this past few months, it's actually for them. They can also watch it and get information. So we have Success Grace. Success Grace, if you know you are live, kindly let me know. I want to take your question because I don't want to answer the question now. Then you come back again and say your question is not answered. So Success Grace, if you know you are listening, I will appreciate if you drop on the comment section. Let me know you are listening so that I can answer your question. Success Grace, if you know you are listening, I will appreciate if you drop a comment in the comment section so I know you are there to listen to the answer. Okay, so let me go back to your question. Success Grace says, Nurse Mary, is 2 days menstrual period okay or not? Your normal menstrual days is usually between 2 to 7. 2 to 7 days. So 2 days is normal. 7 days is normal. Between 2 to 7, it's normal. But one thing I want you to take note of is that if you were seeing it 5 days before, and all of a sudden, you started seeing it 2 days, and all of a sudden, that 2 days likely drop down again to 1 day. So what I would advise you to do is to see your doctor. Okay, but 2 days menstrual cycle, like menstrual flow, 2 days menstrual flow, it's okay. It's okay because the normal is between 2 to 7. But if it dropped down, then I would advise you to see the doctor. And if you're having any other related symptoms, you're having pains, you're having abdominal discomfort, I will also advise you to see the doctor. It could be something else. But on the norms, the normal menstrual flow days is between 2 to 7 days. It's between 2 to 7 days. So if you are watching the video and you've not clicked on that like button, what are you waiting for? Can you click on the like button? It shows that you are actually enjoying what we are doing here. So Joy Diakwa said, the netty cut me off. Oh, I'm so sorry. Cortez says, why is malaria bad for children and pregnant women? Ali Badera Conte, if you are watching, let me know. If you're online, I want to take your question. Just let me know if you are online now so that I can take your question. Conte, if you are online, just let me know so that I can take your question. Now, I don't want to take your questions, then you will not be online to answer it. Okay, Conte, I'm going to take your question. Now, you said, why is malaria bad for children and pregnant women? Malaria is very bad for them because it can get to the brain. As a child, when a child suffers of malaria, the signs and symptoms of malaria, one of the signs of malaria is high fever. You see this child having increase in body temperature. An increase in body temperature can cause increase in metabolic activities in the body. And that is generally not good for the body. As little as malaria, if it stays long, it's not treated, complications of malaria can lead to death. Complications of common malaria can lead to death. So that is why it's advisable as a pregnant woman, as a child, or as an individual, if you're having malaria, can you treat as soon as possible? And don't just treat without doctor's prescription. Don't just treat with assumption. It's time for you to know what you're treating and get it treated out. Okay? So we have a Ramra Rajudedi. Just a out of topic question. How do you greet others in your language? How do you greet others in your language? Raju, why are you so interested in my language? GJ. So the common one we can say J depends. You know, Raju, you are from Indian. Nigeria, we have different tribes, different culture, and different languages. Unlike Indians that understand themselves, that understand their languages. In Nigeria, an Igbo might not understand the Yoruba. A Yoruba might not understand an Hausa greeting. An Hausa greeting is different from an Igbo is different from an Hausa. Hausa is different from, you understand? So that's just it. I think that's not why we are here today. So we are practically here to take as much questions as we can, okay, in regards to health. So I will be waiting for your other questions. Let's keep it coming. Let's keep the questions coming. I hope I've been able to answer your questions. Okay, contest say, what are the danger signs in pregnancy? What are the danger signs in pregnancy? One of the danger signs in pregnancy is bleeding. See, if you notice that you are bleeding, be it at the early stage of pregnancy, the late stage of pregnancy, if you notice bleeding in pregnancy, like bleeding from your vagina, it's advisable for you to run to your doctor as soon as possible. Then the second one I would like to share with you is swelling. If you notice that you are experiencing swellings in your legs, you are like they're swollen, it's advisable you see the doctor. If you're also experiencing increase in body temperature, your body is hot, like you're feeling hot, you're having headache, severe headache, you're taking your normal painkillers, it's not going, you know that you are stressed out, these are signs that you need to see the doctor. And if you've gotten to the second, third trimester, you were feeling your baby's movement, but all of a sudden you are no longer feeling your baby's movement again, that is a danger sign in pregnancy. So when it comes to danger sign in pregnancy, we have the first trimester danger sign, we have the second trimester, and we also have the third trimester. All these things you need to take note of. But the number one, I will always say, it's usually bleeding in pregnancy. If you notice bleeding in pregnancy, kindly see the doctor as soon as possible. Swelling, see the doctor. Like frequent vomiting, you're always vomiting, you're always nauseating, yet you're not taking anything in. You can't even take in water, you can't take in fluid, then see the doctor. If you are feeling dizzy, like you are feeling fatigued, you stand up, you are feeling your eyes are rotating, it's like you are seeing stars, kindly see the doctor. If that dizziness might be as a result of low hemoglobin level, low blood sugar, see the doctor. Okay, then I think that's that. Sorry, I'm checking the Facebook. Sorry, my Facebook just went off. I'm trying to go back. Okay, I've done it. Thank you. So there's another question. What is the other question? I don't know why Bayun Beku, you retracted your message. Then we have Rose Dunya said, please, what is the right time for a woman to start giving birth, please? That question is trickish. For women, I advise, if you can, just give birth as soon as you can, from the age of 24, 25, if you can. So there's no pressure attached to it. So as a woman, the earlier you give birth, the better. The less, I feel it's going to be the less stressful. Because when you are in your 20s, your early 30s, it's much easier. The quality of egg is also much better. Like, there's increased chances of everything working out fine at that early age. In your 20s, late 20s, early 30s is much more easier. So if you can, I would advise you give birth, because the older you get, the less your chances of giving birth, the lesser the chances of you getting pregnant. The older you get, the lesser the chances of you getting pregnant. So it's early if you can, and if it's necessary at that particular time, then go for it. And I feel there's things we should also consider when trying to conceive, and that is your financial responsibility. Yes, there is a lot of myths about people saying that children bring blessings. Yes, I'm sure about that children bring blessings. But there is something you should take note of. You don't want to bring children into the world to come and suffer. You don't want to bring children into the world that will cause you anxiety and depression because you are unable to take care of them. So it's also very important for you to consider your financial status a bit before giving birth to children, or else you're going to cause depression to yourself and also to the kids you are bringing to the world, especially now when the cost of living is on the high side. Cost of living is on the high side. Hey, hello, Diokoros family. How are you doing? I trust you all are doing great. So cost of living is on the high side. So just make sure you are mentally, physically, financially ready to take care of a child before you start giving birth. And when giving birth, give birth to children you are able to cater for. Don't give birth to more kids than you can cater for. So that's what I have to say, Rose Dunia. And I hope your question have been answered. Then the second person, let's say the other question. Why somebody, oh, I missed, what are the danger signs? Okay, why is eclampsia? Sorry. Oh my God. Sorry, I'm trying to get my Facebook. Why? Okay, Facebook is back. Why is eclampsia dangerous in pregnancy? Okay, what is eclampsia? What is pre-eclampsia, first of all? What is eclampsia? What is pre-eclampsia? When you hear eclampsia generally, in a layman's term, just know that there is blood pressure. There's an increase in blood pressure in pregnancy. And when somebody has increased blood pressure, generally an individual that is not pregnant, when you are having high blood pressure, but you're not treating it, it can lead to stroke. It can lead to seizure. So in pregnancy, same thing can happen. It can lead to stroke. It can lead to seizure. And when that leads to stroke or seizure, it's going to affect the baby. So if as an individual, the doctor said you have eclampsia or pre-eclampsia, and they're giving you some medications to take, what I advise you to do is to take those medications judiciously. Don't miss your dose. Take those medications judiciously to avoid strokes, to avoid seizures, to avoid impact on the baby. It can even lead to miscarriages. It can lead to, let's say, a preterm birth. It can lead to preterm birth, your baby coming out on time. So that's something you should take note of. I hope your question has been answered, Beku. Then the other one said, how to stop menstruation. Okay, how to stop masturbation. Samural, I've made a full video explaining on how to stop it. Yes, I've made a video on how to stop masturbation. So all you have to do is to go to our YouTube channel and watch this video. But let me just give you a tip. First of all, you have to agree that it's something you want to do away with. That's one thing. For you to stop it, you have to make a personal decision. Okay, yes, this is what I want to do it. Then why do I want to stop? That's the first question you want to do. Whatsoever you are doing, whatsoever you want to stop, whatsoever actions you want to take, whatsoever goal you are making in life, you have to ask yourself this question: why do I want to do it? Ask yourself this question: why do I want to stop it? So hold on to the why. That is the foundation. Hold on to the why. Why do I want to stop it? So if this is the reason why I want to stop it, I will hold on to that why and work towards it. Because if there is no why, most times you end up not doing it. You end up not doing what you want to do. But if there is a reason why you want to do something, you hold on to it, and that reason motivates you further to stay away from it. So first of all, you have to ask your question: why do I want to do it? When you get a why, that pushes you to the next step. The next thing I would advise you to do, take up anything that will motivate you to do it. Anything at all. It could be the videos you're watching, it could be the people you are following on Instagram, it could be the people you are following on Facebook, it could be what you've subscribed to, it could be the magazines you have. So do away with them. Block those should I say, what do they call it now? Is it motivations? No, those things that ginger you to do it, those things that motivate you to do it. Let's just put it that way. There's a particular word I was trying to get, but I could not get it. But anything that motivates you, anything that pushes you to do it, and you see them around, try to block them away. When you are able to block them away, that goes a long way to help. So we have Nurse Ellie. Nurse Ellie says, what are some signs that labor is beginning? Okay, what are signs that labor is beginning? So I think one of the common signs of labor, that labor is about to set in, is actually contraction. That's how the baby is. With contractions, generally the baby push. So there's a difference between Braxton Hicks contraction and normal contraction. I've made a video on that, the difference between Braxton Hicks and normal contraction. So you have to make sure that it's not Braxton Hicks contraction. And another thing that you should take note of is what we call show, like a bloody discharge coming out from your vagina. You see it, like you just wipe, maybe you wipe your vagina and you see it. When you see show, they call it show. When you see show, that gives you a sign that, oh, labor is about to begin. That show is very important. And if as a woman that is pregnant, your water breaks, that is a sign that your baby is already coming. Water breaks, the show, contraction. Contraction is like a pain, a tightening. When labor is very, very close, the rate of contraction increased that you can't even hold on to it. Personally, I just gave birth. I'm going to share my experience, like from how I knew labor was coming. First of all, a day, like few days before the main incident, I was having my visit to the toilet increased more than usual. Yes, I'm in third trimester. Yes, the signs of labor, it's usually like frequent urination. You want to go to the toilet. I found out that I was always using the toilet morning and night. Few days to it, I was always going to the toilet. Then the day it happened, I saw show. Immediately I saw show, the intensity of my contraction increases. There are some people that will see that show, but are not going to go into labor immediately. They will go into labor days after. While there are some people that see that show and immediately they go into labor. But for me, I saw the show and immediately I went into labor. My contraction intensity increased back to back. It was very, very severe. I was holding it. I was waiting at home. But when I got to the hospital, I was already 8 cm dilated. But my water did not break. Why some, their water will break before contraction begin? Why to some individuals, their water remain intact, but contraction is already far and the dilation is already 8 centimeter, even like 6 centimeter and all that. So these are the signs you should take note of. I don't know if I've been able to answer your question as early or you need more clarification. Just let me know. We explain more. Just let me know where you need more clarification. So, Curtis says, what are the long-term side effects of frequently having STIs and being treated frequently? One of the long-term effects of frequent STIs for ladies is actually pelvic inflammatory disease, which is known as PID. And PID can cause infertility. PID can cause infertility. So if as a lady you are having continuous STI, it's being treated, it can cause PID. Sorry, just give me a break. Let me just. Okay. Kotel, sorry for the break in transmission. I don't know if I've been able to answer your question. Like I earlier said, it's what was I saying? Yeah, PID, pelvic inflammatory disease. Pelvic inflammatory disease is one of the long-term effects of frequently having STI, and that can lead to infertility. Yes, it can lead to the like pelvic inflammatory disease. For example, this is the tube now. Let me just assume what that thing is doing. For example, this is like a tube. That PID might cause your frequent infection, like might cause a scar. That PID might cause a scar and can affect like the sperm meeting the eggs and all that. So frequent STI, frequent treatment of STI can cause a scar, and that can lead to infertility. Yes. So what I advise you to do, if you know you are frequently having STIs or you are sexually active and you're having multiple sex partner, it is very important for you to use protection, and that is condom. And it's something you should take note of. No family planning methods protects you from STI except condoms. So please take note of that. What can someone have? What can someone have? A recurring chronicle. Recurring chronicle. I'm trying to get a follicle. I'm thinking, let me think properly. I think it's not that staphylococcal abscess in the skin. Please, I'm trying to remember what follicle is all about, but I don't think I have a better understanding of that. So I don't want to give false interpretation or false explanation to that. I don't know if I'm correct. It's like a staphylococcal infection in the skin. So I don't know if I'm correct, but what I can do is to go back, research about it, maybe do a video on it, then you can watch it. So I don't give boil under arm. Okay, yeah, okay, I'm right. Boil is like an abscess under the arm. It can also be in any part of the skin. So I don't know why the reoccurrence, but I will study about it, then probably make a video on that. Yes, okay, I was right, but I have no broader knowledge in bad daphronico. What I can do is that I'll try and read about it or have a better understanding and find out the real answer to your questions, then make a video for it. Might not be now, but I'll try as much as possible to do what I can do. Oh, so they say, okay, double tap, guys, kindly for our. Please and please, if you are watching this video, kindly double tap and like the button. So somebody has answered. I have a nurse in the live video. So I have a nurse in the live video. She said recurrent chronicles may result from staphylococcal infection, weakened immunity, diabetes mellitus, poor hygiene, friction, or underlying skin condition like hidradenitis. I think that helps. So maybe you can weigh that and see, does the person have weakened immunity? Does the person have diabetes mellitus? Does the person hygiene is a poor? So maybe that gives us a better insight or why the person is always having recurrent staphylococcus infection. Thank you very much, Nurse Ellie. It's great having you on our live video. Thank you very much, Ellie. So I hope we've been able to answer as much as we can. We've been able to answer. Like, I was just more focused on YouTube that I forgot I was also live on Facebook. So for my Facebook fans, please and please don't forget to go to YouTube and also check up on our YouTube channel. And for those that are following us on YouTube, don't forget to check up on our Facebook page. We just moved all the way from 30 to 4 people watching. So we have content say, what about frequent STI in men? Please answer more. Frequent STI in men is similar to having frequent STIs. What about frequent STI in men? Depends on the type of STI, I would say. It all depends on the particular type of STI. I think this is a good question to actually make a video on and also study about, like, what happens with frequent STI in men and also in women. You will get back for me a full video. Yeah, you'll get back for me a full video on that. Thank you very much. I really appreciate you coming into my life and dropping your question. Thank you very much. Thank you, Nurse Ellie. So for Contail, I think that is going to be a full video. Yeah, expect that video soon. That's going to be a full video. What happens to men who has frequent STIs, and also what happens to women when they have frequent STIs. In this particular video now, I'm going to make a particular video explaining it. It's very, very important for we to educate people on the impact of having frequent STIs. So if you are watching, just double tap the screen to actually like the video. It's going to go a long way to help increase the visibility. It's going to go a long way to help increase the visibility, please. Curtis said, frequent STI long-term effect in men. Thank you for promising me to make a video over my question. Please tag me when you are posting the video. I don't really know how to tag you along on the video when I make them, but just keep in touch. Turn on the notification button of our YouTube channel. So whenever we drop a video, you're going to get notified. Then you check if the video is what you need. But most of our videos are what you generally need for your overall health. Generally, like, when you continuously treat STIs, you are only trying to build your body resistance to some medications. For example, if continuously you are having a bacterial infection and you are treating it continuously, it's not going to be good for you. Trust me. If you are continuously treating STIs every time, you are taking antibiotics every time, your body is going to get to a certain stage. Your body is going to build this resistance. Your body is going to be fighting. Your body is going to be fighting. Antibiotics are no longer going to be working for you. Let me use it that way. Be it a male or a female. So the more you treat those infections, the more your body is being resistant to treatment. The more you treat, the more your body is resistant to treatment. So the best thing is to avoid it. The best thing is to use protection if you know it's going to happen more frequently. So please and please, it's better for you to protect yourself than to endanger yourself. Okay, it said, thanks, Nurse Ellie, our co-facilitator. Thank you, Nurse Ellie. I really appreciate it. Nurse Ellie, I'm trying to remember. Nurse Ellie, can you send me a message on Facebook? I really appreciate. I'm trying to figure out who is Nurse Ellie that joined me today. Yeah, Nurse Ellie said, what are the pros and cons of birth control? What are the pros and cons of birth control? I made a video, full video of that today, where I debunked a lot of myths about birth control, which we generally called family planning method. So the videos will be coming up. But I want to let you know that there are different types of birth control. You get, and this different birth control has different impact on our body. And the reaction to this different birth control depends on the individual and also depends on the body. Especially those birth controls that are hormonal. We have the estrogens, the progesterone. This can actually alter our hormone. It can actually affect our hormone, cause mood swing. And there are some people saying that when they use a particular type of family planning method, it actually causes weight gain. It makes them add a lot of kgs. It makes them add weight. Though there are some research saying that it's like, it doesn't necessarily create excessive weight gain, just a little amount of weight gain. So people come out to say, okay, it causes weight gain. So I made a full video on it explaining that. That's the myths about control pills. Control pills. So control pills are hormonal. So they tend to alter your hormones in your body. You get sometimes. To some people, like I earlier said, they react to it, while to some people, they don't react to it. So generally, you are introducing a hormone into your body. So basically, you're expected to see something different from the norm. Like hormone pills, sometimes they increase your testosterone level, thereby decreasing your libido. There are some people that take some family planning method, it decreases their sex drive. Yeah. Why to some, it doesn't really affect their sex drive. Why to some, it even increases it because they are no longer scared of getting pregnant because they have their family planning method in. So different individuals have different ways they react to some family planning method. While we've been hearing about that, there are some that said, okay, they've had this implant and the implant got displaced. There are some that inserted the IUD and they said, oh, it got misplaced. So different people experience different side effects with this, but it all depends on your body general. I don't know if I'm making sense, Ellie. I like today's live because we got some more questions on our live videos today, which is encouraging. Please and please, if you are watching this video and you've not liked our video, I really appreciate if you double tap the screen to like the video. You are not giving us money, you're just double tapping the screen to like the video. Let's get to 20 likes before the video ends. So I'm going to be going offline soon. And I'm using this opportunity to say thank you for everybody for joining. Nurse Ellie, is your question answered? Just let me know. And Nurse Ellie, I would appreciate if you send me a message on Facebook. I would appreciate if you send me a message on Facebook Messenger. Just try and get across to me. I would like to know who Nurse Ellie is. Seriously, I would like to really know who Nurse Ellie is. Let's see if we have more questions to take. And if there is no more questions, we'll be going offline. And if you're watching this video, kindly double tap and like our video. It shows us that you are watching and you like what you see. And we like the fact that you are getting our content engaged. I'm just going to wait for a few minutes or a few seconds. If I don't get any question, I will be going offline now. I will be going offline now. If I don't get any questions, I will be going offline now. So we have Helen Okes. I get Helen just came online. Good evening, Helen. How are you doing? And trust you are doing great, Helen. Do you have any question for us before we go offline, Helen? Do you have any question for us, Helen? Good evening. Okay, Helen, let's hear your question before we go. We're waiting, Helen. Let's hear your question. So don't mind me, I'm trying to look at my Facebook and also look at my YouTube. So that's why I'm here and there. So Helen, ask your questions before we go. Yeah, Conte, it's nice having you, Conte, around. I really appreciate your presence. I appreciate the fact that you got our video engaging, you asked your questions, It's nice having you, and hopefully we see you in our next live video. Helen, we are waiting for your questions. I'm about to leave. Dr. Travis W. Odingo said, when is your next live? So my lives are usually not predictable. Yes, my life are usually not predictable. But I'm trying to make it more fixed. But for the now, it's not, because I have a child, so they determine when I go live. My children actually determine when I go live, and the availability of their father will actually determine when I go live. So it's when I have the time, I shoot, and I also come live. Okay, Helen Oke said, I am a nursing mother of 13 months old baby, and I'm still breastfeeding. I have not seen my period. Okay, breastfeeding is usually seen as one type of family planning method, though it's not 100% effective, because some women can still breastfeed and see their period. It is normal what you're passing through now. So hopefully when you stop breastfeeding, your period is going to come back. Okay, so breastfeeding is what is causing it. Breastfeeding is what is making you not to see your period. But immediately you stop breastfeeding, probably it's going to come back. But if you stop breastfeeding and you are not seeing your period, then kindly see the doctor. So breastfeeding is acting as your family planning method now. That's why you're not seeing your period. But you have to be careful, because anything can happen. You can ovulate at any time and you can get pregnant even before your menses. There are some scenarios where people, after giving birth, they did not see their menses at all, but they end up getting pregnant. And they're like, how is it possible? I finished giving birth, I did not see my period, and I'm pregnant. It is so possible. Because as a lady, before you see your menses, you have to ovulate. That's, you have to release egg. So before they saw their menses, the time they released their egg, they had sex and a baby was formed. So breastfeeding, yes, it's seen as a type of family planning method, but we have to be careful so we don't get pregnant even before the period shows up. I'm getting a call from my mother-in-law. I'll just send her a message. So have I been able to answer your question, Helen? Okay, yeah. He said, okay, thank you so much. Yeah, it's normal. As why you are breastfeeding, seen as a family planning method. But to some, it might not work. I've seen some certain women that they are breastfeeding and their menses came like a month after they gave birth. So we are different. There's something about women's body that's quite different. It's quite unique, and women react differently sometimes. So in general, breastfeeding is seen as partially a type of family planning method, but you have to be careful. That's what I have to say about that. Do I have any much questions? Helen, if you've not clicked on the like button, just double tap your screen and just like the live video. That shows I've answered your questions and you appreciated it. I was trying to get to 1 hour, but I don't know if it's going to be possible. Okay. Rem said, can we ask questions about our sexual life? Yes, you can. If I can, I'll be able to provide answers for you. That's what my videos and my lectures are all about. Feel free to ask your questions. If it's what I can provide immediate answer for, definitely I will. But if it's not something I can provide immediate answer for, I might work on it and make a video for it for you later on. Elsie says, I don't use any family planning method. Anytime I meet my husband, I use pills. Is it okay or all the time? Okay, let me answer. SC, are you online? If you are online, say hello. I want to answer this question now, particularly for you. SC, you asked a question on family planning method and you're using pills. If you are online, say yes. Okay. Let me tell you something. Generally, it's okay for you to use it, but I don't advise you. So what I advise you to use is that, first of all, have a tracker, track your ovulation. If you want to be taking pills, so you don't end up taking a lot of pills. Emergency pills, if it's the emergency pills you are talking about, emergency pills, like it's an emergency. It's not something I advise you take regularly. It's not something I advise you take every time, because like the name implies, emergency pills. Okay. So what I would advise you is that know your cycle. Like know your cycle, know when your ovulation is close. So if you know your ovulation is close and you want to have sex, then you can take the pills. But if you know you're on your safe period, you can also have sex and there will be no need to take the pills. See, natural ways of avoiding pregnancy, it's safe if used correctly, if used effectively well. So if you know from your cycle, I'm very sure this is my safe period, there's no need for you to take pills. But if you are not sure, then you can go on with the pills. But the pills can fail you sometimes, especially if the egg has already been released. If your egg has already been released before you take that pills, it can fail you. So that is why it's very important for you to just know your cycle. Take the pills when you know it's around that corner. So that helps you relieve your stress. Because Postino 2 can fail. You've seen people saying, oh, I took post pill, but yet I got pregnant. That was because they didn't know their cycle. They took the post pill when the egg has already been released and fertilization took place. When the egg has already been released and you take Postino, it's not going to work. So that is why having an idea, what I would advise you to do is to have an idea of your cycle, know your menstrual cycle, know how many days cycle you have, and know when you're ovulating and when you're expecting your next meses. That's going to go a long way to help you. So Elsie, I've answered your question. So I have Ram, you said, I am a preemie mom. Now my baby is 38 weeks. I'm using breast pump. I find very less milk flow. When I breastfeed, he takes a very little amount and wakes up in minutes once he urinates. Wait, your baby is 38 weeks old. 38 weeks old is like how many months? Please, somebody help me with the calculator. 38 weeks old is how many months? I want to know. 38 weeks. My brain is not calculating. Please and please, how many months? Just put it in months for me. It's easier for me to explain what I want to explain. Please and please put it in months for me. It's easier for me to explain. Please suggest how I can make the baby to latch more. Is it because it's too young to take sufficient milk? See, tell me the months, but let me tell you, when it comes to 9 months old, so definitely your baby has started. Thank you very much, Dr. Travis. Thank you very much. My brain is not taking. Thank you very much. The baby is 9 months old. So in terms of that, I believe your baby should have started, must have started eating, must have started taking something outside the breast milk. Yeah, you should start feeding your baby breast milk. The breast milk will not be enough to survive him. So what I would advise you to do is to combine your normal feeding with the breast milk. And if you want to latch properly, your baby is 9 months. It might be difficult to put them in that position you would normally put them when they are babies. You can express in between his breastfeeding. Express in between. If he breastfeeds now, use your pump to express, because the more you stimulate the nipples, the more it sends signals for breast milk to be produced. So what I would advise you, if he breastfeeds to his own satisfaction, put the breast pump, express, that gives more milk. Okay, so you have to express. You say 0 months. Are you saying 0 months? I don't understand. I don't understand when you say 0 months. Sorry. I don't really understand when you say 0 months, Raju. But one thing I know, when it comes to breastfeeding, you have to put your baby to breast as much as possible. Then the other thing okay, you are 38 weeks pregnant. Okay, now 38 weeks in pregnancy calculation, and he's a preemie born in 31 weeks. Okay, I think the best thing for you to do now is to do more of breast pumping and try to be bonding. Like, let it be skin to skin. Be putting the baby to your body, like skin to skin. Don't put on clothes. Allow your baby like rest on your body, like that bond within your body. Let your baby be feel like let your baby be close to you regularly. Allow your baby to be close to you regularly because it's still primary. Because you see that latching reflex, ability to suck properly, they have to learn it. They are just coming, they are going to learn it. So to some baby, they just come and they're able to latch properly. But some baby, it takes time. So what I would advise you to do, I don't know how many months, okay, your baby is 0 months. So try as much as possible to put the baby to breast. Okay, don't say, oh, okay, whenever he cries, anytime your baby, whenever he cries, feed on demand. Always put him to breast. Always like feed on demand. If you want to breastfeed exclusively, yeah, feed on demand because breastfeeding has not been established yet. So you have to continuously put the baby to breast regularly. Then also express in between the breastfeeding because that's going to send signal that, oh, the breast needs more milk, the baby needs more milk. That is why it's getting stimulation. Always put him to breast on demand. So forget that what people keep telling you, oh, feed your baby every 2 hours, feed your baby every 3 hours. No, no, no. At the very beginning, if he cries, put him to breast. Anytime he cries, I know it's very difficult as a mom, like always put it, but try as much as possible to put them to breast. The more you put them to breast, the more you send signal to the brain to produce more. But if he cries and you're like, oh, it's not up to 2 hours he ate, it's not up to 1 hour he ate, and you ignore him, it's not going to be helpful. So put them to breast. Their stomach is pretty small, it's not big. So if your baby is crying every 1 hour, if you can, put him to breast. That is why I encourage new mom to always get help around. Like, so these helpers actually help them with other things while they focus on establishing breastfeeding, while they focus on putting the baby to breast regularly. Rem said there was a size increase in my girlfriend's breast over 4 months. She's 24 years old. What does this signify? Sorry. Raju, I hope you okay. Thank you. Okay, she has gotten answers to my question. That's answers to our question. I mean, that's good. I'm glad I've been able to answer your question, Raju. So let's go to REM 1. He said there's a size increase in my girlfriend's breast over 4 months. She's 24 years old. What does this signify? So if you notice like there's actually an increase in size, I would advise her to do a self breast examination. Yes, a self breast examination to find out if there is any nodes around, if there's any strange thing around the nose. She should just watch the video on how to assess her breast herself. Let her assess it. But if she's finding it difficult after assessing it herself, I would advise her to go to see a doctor. Okay, because when there is an abnormal growth in the breast, it could be benign, it could be malignant. It's advisable for you to just see the doctor and rule away all doubt, especially when you notice there's a significant increase in the breast. But generally, during some ladies during ovulation, they kind of experience this increase in their breast size, and also during menses, they kind of experience this increase in their breast size, which is normal. But if you see it's like it's not going and coming, it's just there, it keeps increasing in size over the period of 4 months, then I would advise you to tell your girlfriend to see a doctor just to rule all that and to make sure that everything is fine. Wow, that's good. We did a scan. She does not have any abnormal growth. Can this mean she's pregnant? If you are doubting if she's pregnant, let her do a pregnancy test, okay? Because some ladies, when they are pregnant, generally ladies, a woman, most percentages, when they are pregnant, there tends to be an increase in the breast tissues, which is normal. So if you are doubting that could this particular woman be pregnant, it's advisable for you to do a pregnancy test. Just get a pregnancy test strip and do it in the house. Dr. Travis said, does condom have negative side effects to both genders? I don't really know of any side effects of condoms. I don't really know of any side effects of condoms that I can say. But one thing I know is that it prevents STIs. I have not really heard about side effects of condoms. But I just know if condoms are used properly, it protects you and it also protects your partner. Just do a pregnancy test, Remy, if you are finding it like maybe your partner has something serious, do a pregnancy test, and I believe that's going to tell you if she's pregnant. But generally, when it comes to breast sizes, one is usually bigger than the other. One is usually bigger than the other. So you have to take note of that. So Raju said, Dear Mary, once the baby lose weight, whenever we breastfeed him on demand instead of 2 hourly feed, I'm using formula milk. I'm using formula milk top up breast milking because he takes 60 minutes. No, he's not going to lose weight. When you are breastfeeding on demand, your baby's going to gain weight. You are breastfeeding him regularly, he's going to gain weight. When you are breastfeeding regularly, he's going to gain weight. My son, my baby that I just gave birth to, is 2 months, was 2 months yesterday. It's 2 months old now, was 2 months yesterday, completed 2 months. And I always breastfeed on demand. I'm doing, personally, I'm a fan of exclusive breastfeeding. I'm exclusively breastfeeding him, and I'm feeding him on demand. When I say on demand, when I hear his cries and I know he wants food, I feed him immediately. So it's not a matter of if I fed him 2 hours ago. I just feed immediately. That's me. I'm telling you what I do. And he added weight. I said now I think he's 5 point something kg. The last time we checked, that was when he was 6 weeks. When he was 6 weeks, he was already 5 kg. At birth, he was 3.6 kg. So I feed on demand, and he's not losing weight. And if your child is losing weight, I feel you are going to tell as a mother, you're going to know as a mother when your child is losing weight, when you carry your child. So breastfeeding on demand won't make your child lose weight, but rather it's going to make your child add weight. But I would like to really know why you are using formula. Is it because you are not producing enough? Is it because you're working? What is the reason? Why are you using formula top up? Because if breastfeeding is not fully established and you're using formula, your baby might not be sucking as much as you expected. Because when your baby is supposed to be sucking, your baby is taking formula. So breast milk might be going down because breastfeeding is not fully established and you are giving formula. So for some mothers, formula is given for some certain reasons. So that's why I'm trying to find out, why are you giving formula? Are you giving formula because you don't have enough breast milk production, you're working, something came up, or you could not, or for personal reasons? Because when breastfeeding is not fully established and you started giving your baby formula, your baby gets fed up with the formula and he might find it difficult to suckle to get breast milk production on the high side. So that's something you should also take note of. Raju, I would like to finalize your answer before I go offline. You're the one keeping me online. I just hope you're able to understand what I'm saying. Do you get what I'm saying, Raju? Okay, it's like Raju went offline. She's the one keeping me offline because that's her last question. I just want to make sure she and the baby is fine and breastfeeding is going on well. Okay, since we are not having a lot of questions anymore, all our questions are over. We've spent up to 1 hour on this live video. I think it's high time for me to say thank you very much for staying tuned on our live video. Expect more interesting videos from us. We are going to take your questions. To all those that I took questions to, okay, Raju. Okay, Raju said, my goodness, thank you. It's been 2 months since I lost my proper sleep because of the 2 hourly feed. You cleared my doubts. Oh, I'm thanking God that I was able to clear your doubts. It's a good thing that I'm able to clear your doubts. And I hope you and your baby are doing great. That's what just I want to know. If you're having any question, just let me know, Raju. You can send me a message on IG. I can give you the little support I can. Just let me know. No. I fear he's premature baby and he might become weak. No, he can't. Just feed on demand. It shows that your baby he's eating well. So if he's crying for feed and when you put the breast milk, he sucks. There's no problem. Just feed on demand as much as you can. Just feed on. So XYZ, I think that's the only thing I can take now. I've tried. My baby needs me now. What I do, Raju, now that I'm live videos, I fed properly before going on live, but I make sure that I have express breast milk down for him. So even if I'm doing the live video, I have my milk already expressed for my baby that my husband is going to help me give. Okay, so that's how I've been able to balance it, and I've been able to do my exclusive breastfeeding. So that's that. So we have, thank you so much, Jen Mary. I will more breastfeed from now. Yeah, do it. Don't be scared. Breastfeed on demand. That's what I do. I breastfeed on demand. Sometimes, the fact is, sometimes I feed, like for example, I feed my baby by 1 p.m. and the next 2 p.m. he's crying. I feed him. Then sometimes I feed him 2 p.m. and he sleeps 2, 3, 4, 5, 6. He can sleep for 4 hours straight. He can even sleep for 5 hours straight. Okay, so sometimes they feed back to back, and sometimes they feed back and just sleep for a very long period of time. Then if you can, after breastfeeding on one breast, put the baby to the other breast, let them suckle a bit. But don't be in a haste, like immediately you feed, so I'll just feed for 2 minutes and you no. Allow them suckle very well so that they can get both the fore milk and the hind milk. There's something you need to know when breastfeeding, that your breast milk has both the fore milk and the hind milk. So when the baby takes the fore milk, your baby should also take the hind milk too. So when they take both, it's more better because the hind milk contains more fat than the fore milk. So let your baby stay long. The longer they stay in the breast milk, the better. Oh my God. Okay. XYZ, ZY. What's your question? You have been answering. Be fast. Just type your question as soon as possible. I want to go offline now. Just type. I need to go offline. Just type your questions as quick as you can. I'll be coming live again. I'll be coming live. I don't want to promise tomorrow and fail. No, I can't come tomorrow. Probably on Wednesday, I'll be coming live. On Wednesday, I'll be coming live, but not today. Just be fast. Those that say they have their question, just be fast and ask the question so that I can go offline. I'll be coming live on Wednesday, but tomorrow I'm not coming live because I have a dental appointment alongside with my daughter. So we'll be going for a dental appointment tomorrow. So we won't be able to make the live video. So Ms. Ellie said, what vaccinations are recommended for infants? When you give birth to a child, it all depends on the country you are. So different countries have different vaccination that they give to infants at their different age. 0 months, the one they give at 8 months, 8 weeks, 8 weeks. Advice you give the children vaccines. So I can't say, depending on the country you are, follow your vaccination or your immunization schedule and make sure your children are properly vaccinated. That's all I can say here. So I advise you vaccinate your children with what is available in your country and don't be selective about it. Because immunization is based on what's like immunization. They immunize children based on the prevalence of a particular disease. So if you are immunizing them, you are only protecting them against that disease. So it's advisable that whatsoever vaccination your country is offering for the kids, you give it to them. That's what I advise Nurse Ellie. XYZ, ZYX. I've been waiting. I can't find your question. Your question will be postponed to our next live video. What I would advise you to do is to turn on the notification bell. So when we come live next time, you will be live to drop your questions and we'll be able to answer. All right. So this is what I have to say. Thank you very much. I'm sorry I'm unable to finish all the questions, but I've spent more than 1 hour. And remember, I am a nursing mother and I have a baby I have to look up to while I'm looking after my audience. Thank you very much, everyone, for staying on our live video. Don't forget to like if you're just coming across our YouTube channel or our Facebook page for the first time. Don't forget to like, don't forget to subscribe, and also don't forget to share this YouTube channel with your friends so that they stay informed with important health content. Oh, we got a gift. That is good. Thank you very much, Raju. This is the first time I'm receiving gifts from YouTube. Thank you very much, Raju, for this beautiful and wonderful gift. I really do appreciate it. Thank you very much. Thank you, Raju. Thank you. This is the first time we're actually receiving gifts on YouTube. Like, I hardly get gifts from YouTube, but I appreciate you. I say thank you very much. Okay. So thank you all, and see you all in our next live. So share our videos to all your friends, share our videos to all expectant mothers, to all nursing mothers. Let them come and ask Nurse Mary questions, and we are definitely here to answer your questions every day. Thank you very much, and see you in our next live video.